$50 billion. That's the staggering cost of a crisis threatening your health and the well-being of millions across the nation. This isn't a future problem. It's unfolding right now, in your communities. Your local hospital could be next, leaving you stranded in a medical desert. This hidden financial pattern means vital care vanishes, impacting lives and economies. Let me show you how this silent collapse works. The numbers tell a story of systemic failure, where essential services become casualties of economic forces. This isn't just about healthcare, it's about the very infrastructure of your community crumbling under pressure. The promise of accessible healthcare is eroding, replaced by vast empty zones. We'll uncover how regulatory oversights and misaligned incentives are creating these critical gaps. This impacts everyone. Historically, hospitals were community anchors, built on local support and clear purpose. They were symbols of progress, offering hope and healing. Their financial models once seemed robust and sustainable. But even centuries ago, the seeds of financial instability were sown by shifting demographics and economic pressures. Early institutions faced challenges in balancing charity with solvency, a pattern that would repeat. Understanding this history reveals how quickly essential services can become financially vulnerable. The delicate balance between patient need and economic viability has always been a tightrope walk. This is the truth. Many early hospitals relied heavily on philanthropic gestures and local taxes, methods that proved unsustainable over time. This financial fragility set a dangerous precedent for the future of healthcare infrastructure. The early 20th century saw a boom in hospital construction, often without long-term financial planning. Government initiatives sometimes encouraged expansion without fully addressing the economic realities of ongoing operations. This expansion, though well-intentioned, created a sprawling system vulnerable to economic shifts and policy changes. The foundation was built on optimism, not always on sound, adaptive financial models. It's a critical detail. Early examples show small community hospitals struggling to adapt to new medical technologies and increasing administrative burdens. They faced a tough choice: modernize at great cost or slowly fall behind. Many simply couldn't keep up. These initial failures were often dismissed as isolated incidents, unique to specific regions or management. Yet, the underlying economic pressures were universal, quietly building into a larger, repeating pattern. The American Hospital Association reported that between 2005 and 2019, 120 rural hospitals closed. This dark data reveals a pattern of financial distress that began long before the recent headlines. See the pattern? Similar financial strains, driven by reimbursement challenges and declining patient volumes, foreshadowed today's crisis. It's not new. This is the recurring challenge. For decades, hospitals have been caught in a financial vice, squeezed by rising costs and shrinking revenues. The system itself has inherent weaknesses that are now fully exposed. This is critical for your understanding. The myth of endless healthcare funding met the reality of unsustainable operating costs. This contrast highlights a fundamental flaw in how we structure and fund our essential medical infrastructure. It's a systemic issue. The trick is deceptively simple. Create a complex web of billing, insurance, and regulatory requirements. This opaque system then becomes almost impossible for an average hospital to navigate profitably. This is how it works. Hospitals are forced to compete in a market designed to disadvantage them, especially those serving vulnerable populations. The sheer volume of administrative tasks drains resources away from patient care. That's the hidden cost. A 2023 Government Accountability Office report highlighted how Medicare and Medicaid reimbursement rates often fail to cover the actual cost of care, creating a persistent financial shortfall for many hospitals. This means hospitals are essentially losing money on every government-insured patient, a burden they cannot sustain indefinitely. It's a financial black hole that silently devours their operating budgets. You're paying for this. While some institutions thrive on high-profit procedures, many community hospitals are left with the low reimbursement cases. This creates a two-tiered system where profit dictates access, leaving millions vulnerable. The system is designed to transfer wealth from patient care to administrative overhead and insurance profits. This is not a bug. This is the design of a flawed economic model. It's time you see it. And here's where it gets terrifying. These closures are accelerating. Right now, more hospitals are teetering on the brink than ever before. Your access to emergency care is directly at risk. Today, the same pattern of underfunding and administrative burden is creating new medical deserts at an alarming rate. This isn't just a rural problem. Urban hospitals are also facing unprecedented pressure. In major cities, once bustling medical centers are scaling back or shutting down entire departments. This means longer wait times, increased travel, and delayed diagnoses for everyone. It affects you directly. The consequences are stark: increased mortality rates, poorer health outcomes, and overwhelmed remaining facilities. It's a domino effect that impacts the entire healthcare ecosystem. This is happening right now. While the powerful few profit from the complexity, ordinary citizens lose their access to life-saving care. This contrast is a brutal reality of the current healthcare landscape. Think about your family's needs. Understanding this pattern isn't just academic, it's a matter of survival. The next time you need urgent care, will your hospital still be there? This is the critical question we all face. So, what should you take from this devastating pattern? First, understand that healthcare is not just a service. It is a critical piece of national infrastructure. Its collapse has cascading effects. Second, recognize that financial stability in healthcare is a shared responsibility, not just a hospital's burden. Regulatory bodies and policymakers play a crucial role in safeguarding access. We must demand accountability. Third, build awareness in your community about the fragility of local healthcare institutions. Advocate for policies that prioritize patient access over profit margins. Your voice matters more than you think. The National Rural Health Association reports that over 1,400 rural hospitals are at risk of closure. This modern proof solidifies the pattern. Without intervention, this crisis will only deepen. This isn't prophecy, this is mathematics. The current trajectory is unsustainable, leading to an inevitable breakdown unless fundamental changes are made. Anyone with a calculator can see the truth. Knowledge is the only protection in this complex system. Once you see the patterns, once you understand the mechanisms, you are no longer a victim. You become an informed protector of your family's future. Understanding this changes everything. It empowers you to ask the right questions and demand better from those in power. Now you know what they don't want you to know about your collapsing healthcare. If this revelation opened your eyes to the invisible forces shaping your world, subscribe. My next video will expose the hidden agenda behind universal basic income. Is it a lifeline or a leash? What other essential systems are silently crumbling around us? Collapse Report has the answers. I'll show you where to look for the truth. Join us.